Hi, I'm John Sullivan with 401k Specialist, and this is the 401k Specialist Podcast. The final rule on healthcare pricing transparency was released in late October, and it's a big deal. Called Transparency and Coverage, 3 separate federal departments announced its arrival. So, what does it mean for health savings accounts and healthcare in general? We asked top advisor Jamie Greenleaf for help. She recently launched Tilt, a health benefits advisory firm, and she explained what will happen now. Jamie, the transparency and coverage final rule was released yesterday by Health and Human Services, Labor, and Treasury. What should we know about it?
Well, it's a great start because people really don't know what things cost. And this is going to add transparency on costs around procedures, which is fabulous. However, if you think about it, most people don't care what things cost because they think the insurance company is going to take care of it. So they care up until their deductible and then they don't care anymore. So right. I think while this is a great first step, I think we need to do some more education around transparency and care of cost.
It's a somewhat obvious question, but can you just relate it specifically to HSAs and how it's affected?
Sure. So traditionally, when you're in a high deductible healthcare plan, hopefully you're saving those premiums in your health savings account. And that means that when you go to the doctor and the doctor says, hey, I want you to go get an MRI, and you say to the doctor, oh, well, what does that cost? Because it's coming out of my HSA account because I'm paying for it. Traditionally, the doctor will say, I really don't know, because honestly, that's not what their job is to know what the price of things are. In the past, you may not know what the price of an MRI is, and therefore you may have gone to a high-cost provider as opposed to a low-cost, high-quality provider. So this regulation is going to peel back the onion and allow people that are taking money out of their own HSA account to pay for procedures to understand what the actual cost of the procedure is prior to going, and hopefully will give them the ability to shop for high-quality, low-cost providers.
Understood. Has this been a long time coming? What kind of a fight has this been? I mean, I'm just looking at this, and you've got 3 government agencies or departments that are involved in the release, so it seems like everybody wants to jump on board. Pretty big deal?
Really big deal, but it's taken a while. At the beginning of this year, you might remember that they came out with a transparency regulation around hospitals, and hospitals needed to conform to providing cost of care to patients. And the hospitals actually sued the government trying to prevent them from doing that. And it was thrown out. And as of 1/1/2021, hospitals now have to have the ability to talk about what cost of care is going to be with a patient. This now takes it a step further. I think from a fiduciary standpoint, I think people forget that healthcare plans are covered under ERISA, which means that all of the committees that oversee their healthcare plan are fiduciaries. And one of the things that fiduciaries have are duties around, is this in the best interest of the participant? Are we paying reasonable costs? Well, before they didn't know what the costs were. And now right. There's going to be some light added to the black box. And so I do think this is a huge deal. It's been a long time coming, and it's been needed in the industry for so many years. I don't think it's going to fix everything, but it's a start.
Jamie, what's happened with HSAs in the pandemic, and how are savers using them? What trends are you seeing?
Interestingly enough, I think most people that have HSA accounts, in some cases, they're accidental. In other words, they signed up for the high deductible healthcare plan. They open an HSA account because that's what they were told to do. And their employer made contributions, and they may not even realize that they have an HSA account. So I think a number of them actually have remained relatively stagnant. But then I also think a lot of people that got laid off realized that, wow, I can use these HSA accounts for things like COBRA, and probably started to recognize that there was value to these health savings accounts where they didn't really understand that prior to this. So I think it's helped people. And I think people that are using them are thankful that they have them. It's just unfortunate that most people don't have enough money in there to really have an impact, a meaningful impact on what's going on.
Are you seeing greater awareness of the CARES Act provisions and some of the changes that were included?
No.
Yeah.
I mean, really, let's face it. I think most people are just trying to keep their head down and keep their sanity. And there's so many things that are coming at people around everything that's going on in the pandemic. I just don't think that the HSAs are something that they're really focused on.
Yep. Yeah. Sometimes we get entrenched here. We're kind of number nerds when it comes to HSAs. We think everybody thinks like we do, but yeah, they've got a lot more stuff happening. So, any changes on the horizon for HSAs that you see?
I'm hopeful that this transparency of coverage will start to make people aware that we've been ripped off for so many years and that it's time for us to take accountability and control over our healthcare costs. And moving from that defined benefit space of the HMOs into the defined contribution where we become a consumer of healthcare, I'm hoping that this transparency regulation will highlight that we do need to become consumers. And in doing so, most of us will find that the high deductible healthcare plans are a better option for us because statistically speaking, they say about 80% of us overinsure ourselves. Those are dollars we could be putting away for healthcare expenses in at a later time. So hopefully this will kind of highlight that.
By responsibility, are you talking about the fact that I can't drink a keg of beer and eat a box of donuts and go to the doctor the next day and ask for a pill to make it better?
Yeah, that. And I also think that when the light bulb goes off that they've been making the insurance companies very wealthy and not utilizing the system, and that these are dollars that they could be putting back into their pocket. I think that's the awareness we need. Unfortunately, I think most of us are still going to drink a keg and eat a box of donuts.
Right. Yeah.
Because that's what we do as Americans, right? We tend to overindulge.
I love this country. So it just so happens that you have a new HSA-related venture. What is it?
It's called Tilt, and you can find us at tiltthebalance.com. And we are really trying to empower employers to take control of their healthcare dollar through being bold in their plan design and building a new plan that aligns the stakeholders financially, so the employees and the employers, and then educate the employees as to why adopting a high deductible healthcare plan may be more beneficial to them, and help them really build medical equity for healthcare expenses throughout their life. Inside of that app that we also have a transparency tool, which allows people to actually shop for procedures, which is always eye-opening to them when they go in and see that their MRI could cost them $300 or $3,000, and that's all in network. And they think, oh my God, I've been doing this wrong for so many years. So we're super excited about it.
That is fantastic. Jamie Greenleaf, Cafaro Greenleaf, that's exactly what we needed. Thank you so much for joining us.
Thank you. Have a great day.